seizures in general would fall to this category?
Yes, seizures would fall into this category. Yes, exactly. Good point. Thank you for saying that. I have been told by a neurophysiologist, I'll just tell you this because you brought it up, it's his opinion, and he told me this a number of years ago. He says, believe whatever you want, believe what anyone says if you want, but I tell you that all seizures originate in the mesencephalon. That's what he said. I don't know if it's true, but that's what he said. So whenever I have a patient who has seizures, and I don't see too many of them, I'm always looking for transneural degeneration in the mesencephalon. But somewhere, remember this is a continuing process, an ongoing process, and a kind of a snowballing kind of process. So you could have T&D anywhere along the pathway, before, after, or in the middle of, say, the mesencephalon. So, but that's, yes, seizures would be spontaneous firing of neurons. And when you think of it that way and put it in this perspective and think in terms of the brain on fire and controlling that spontaneous firing by using inhibitory neurotransmitters, changing cytokines so the microglial cells don't maintain the depolarization, and finding the source of appropriate neuronal stimulation, in this case probably inhibition, all of a sudden it gives a different perspective on what seizures are. And they come a little bit out of the realm of scariness and to something where maybe we could figure this out. Now, I mean, there's some kind of patients who have seizures from different reasons, where they've had brain damage or they have some genetic thing or something, and it's tough. But what do the medications for seizures do? Basically, they just turn down the volume on the whole brain. They're mostly GABAergic or GABAergic type things, and they just basically inhibit. And they inhibit your consciousness as well. You get lowered cognitive function many times and all kinds of other issues, but they keep from having a seizure. So don't get me wrong, some of the more recent anti-seizure medications, I have an old guy, he's got to take that. He's 75 years old, and this guy's had wear and tear in his life, and he's been taking anti-seizure medication for 10 years. So we have to we're not going to take him off the anti-seizure medication. He's got places in his brain that are just not around anymore, and the seizure medication protects him from the seizure. He's got some dead neurons in there. So what do we do? Otherwise, he's cognitively really good. He's physically pretty decent. We just have to protect him by making sure he can detoxify the meds as best as he can so that he doesn't get overdosed on the meds, and protect his immune system from the adverse effects of the on the immune system of the meds. I never try to take anybody off a med who's been on it for a long time for seizures, because sometimes they actually have some neuronal degeneration somewhere that you're not going to be able to get them off it. So don't get me wrong. When I'm saying it gives us a new perspective, it doesn't mean we're going to be able to get everybody off their seizure meds, but most of the seizure meds turn the volume down on something, and there are other ways of doing it. So if you happen to catch the patient early enough on, maybe you can do something about it before there's too much tissue destruction. And then sometimes, as I say, there are inherited things and so on that sometimes people you're not going to be able to do anything about it. Tumors and things like that, the pressure things, you're not going to be able to do anything about it. So, but it just gives a different perspective on what we thought of as seizures, which always are kind of mysterious, always been kind of mysterious.